Alright, this is ankle phase 1. The first exercise we're going to do is A10. This is active range of motion of the ankle here, all planes. We also have the alphabet if they want to advance to that. So first you just have the patient, probably their feet dangling off the table. Right now we just have a low table. So you just have the patient go into some dorsiflexion, plantar flexion, hold at each end range for about 5 seconds. And again, their leg would probably be dangling off the table here. A little plantar flexion, dorsiflexion, a little bit inversion, eversion, let the ankle do it, try not to let the knee move at all. So it's all the ankle, eversion, inversion. Then you're just going to have the patient do some clockwise, counterclockwise circles here. And then once they're pretty good with that, you just advance them to the alphabet. You just have an A, B, C, D. Just go through all of those for the active range of motion. Next, I'm going to walk over to the wall here. This will be A11, gastroc soleus stretch. This can be done using a wall or a platform if you have it at your office. You just kind of key the patient, kind of put the arch of their foot up in the air, the toes on the wall. Just kind of the legs straight, you're getting closer to the wall. We should feel that stretch in behind here. You just want to feel a slight stretch. You don't want it to be painful with the patient. Hold that position for about 20 seconds. You can advance to 30 seconds. There's about 3 or so on each foot. Legs straight, and you're just leaning into the wall. Next, I'll demonstrate the runner stretch. If the left leg was the affected leg, I have in the back. The heel is touching the carpet. The front leg slightly bent. Hands are just comfortably in front of them, stretched out. And to get more of a stretch, just let the front leg bend, move closer to the wall. If you notice the heel doesn't come up, oftentimes you'll see the heel come up and they'll say they don't feel a stretch. Just make sure the toes are pointed straight. That's a good key. Oftentimes if the toes out, they won't feel it at all. So the toes are perfectly straight, front knees bent, heels on the ground. Hold that position for 20 to 30 seconds. And there's those two. Next, I'll come back to the table. Next exercise is A12, which is the ankle wobble board seated. You just grab a ball that goes underneath your wobble board. There's probably different sizes, just based on the patient's, what's the word I'm looking for? What they're able to do. So this is one of the larger balls. You just want to where the platform is kind of 90 degrees underneath their knee there. So you want the patient to do some plantar flexion, dorsiflexion, so up and down. Try to get the rim of the board to touch the carpet. So up and down, then we'll do side to sides. Then we'll do some clockwise, counterclockwise, trying to get the rim to touch the carpet all the way around. So some things they'll do, they'll get their knee out here, or get it really far underneath them. So we just want the knee, leg in a straight line there, 90 degrees. Next, we'll do, so that was A12 and A13. A13 was the clockwise, counterclockwise. Next, we'll do the rope range of motion stretches. This is just inversion and eversion. So if you have a rope or just a strap, we'll strap that underneath the arch of the foot. And you're just knees bent. You're just going to hold that stretch for maybe 20 seconds. Your arms are kind of doing most of the work. So you're just going to hold each one. Just inversion and then back to eversion. If you want to get the whole leg straight, you need to. If you mean sitting long seated. Next is the ball under the foot. This is really just to stretch that arch out under the foot. Just go forward and back, side to side. You would set a timer with this exercise. This one's pretty simple. Just try and get their knee under their foot there. And then next, we have stick work. This will be the last one of the phase 1. This is A16. So you just kind of bring a stick or anything you have in your office. We're just rolling up and down the calf. Try and get any muscle knots out of there, loosen that muscle up. If there is a knot, just have them hold there for about 5 seconds. Really push it out. This is behind the leg here. Just put the gastroc, and then we'll get the anterior tib. Just on the outside, sliding up and down right through there. Patient probably tender. Probably a good 30 seconds of this exercise. And that concludes phase 1 of the ankle.